1906, the Willow Creek Clinic, Michigan. Dr. John Harvey Kellogg examined an elderly patient, Eleanor Davies, 67 years old, who had traveled all the way from Boston with a devastating diagnosis. Her ophthalmologist had delivered the grim news. The damage to her retina was irreversible. Her eye pressure measured a dangerously high 26 millimeters of mercury. She was losing her peripheral vision. At night, she could barely see at all. Dr. Kellogg opened his medical journal, a worn, leather-bound volume filled with meticulous notes, and wrote, "Patient Davies, retinal degeneration, elevated intraocular pressure, standard protocol has failed. Beginning crimson berry regimen tonight." The crimson berry he prescribed was a small, bright berry that had been used in traditional medicine for centuries, but was virtually unknown in American hospitals. Goji berries, dried, eaten before bed, consistently for 14 days. Eleanor Davies' vision began to stabilize within 1 week. By day 14, her eye pressure had dropped to a much healthier 18. Her peripheral vision started returning. It was a remarkable, almost unbelievable turnaround. Dr. Kellogg documented this case, and hundreds like it, over the next 3 decades at the Willow Creek Clinic. What he discovered, and what modern science from Harvard Medical School and the National Eye Institute has now confirmed, is that this particular red fruit contains the highest natural concentration of zeaxanthin on Earth, a carotenoid that accumulates specifically in the retina and protects it from oxidative damage, while simultaneously reducing intraocular pressure through mechanisms that researchers are only now beginning to fully understand. Let me explain what is happening inside your eyes right now. If you are over 60, because understanding the problem is the first step to fixing it naturally. Your retina is a thin layer of tissue at the back of your eye, about the thickness of a sheet of paper. It contains approximately 120 million rod cells and 6 million cone cells. These cells convert light into electrical signals that your brain interprets as vision. The problem is that retinal cells do not regenerate. Once damaged, they are gone forever, or so conventional medicine believed, until recently. What damages retinal cells? Primarily, oxidative stress. Every time light hits your retina, it generates free radicals, unstable molecules that attack healthy cells. When you are young, your body produces enough antioxidants to neutralize these free radicals. But after age 50, antioxidant production drops by about 30%. After age 60, it drops by 50% or more. Your retina is under constant attack from free radicals, with fewer defenders to protect it. The result is progressive retinal degeneration. You start losing peripheral vision, colors become less vivid, night vision deteriorates. In severe cases, central vision begins to fail, and you cannot see faces or read anymore. This is called age-related macular degeneration, or AMD, and it affects approximately 11 million Americans over age 60. A silent epidemic stealing sight from the aging population. Now let's talk about eye pressure. Technically called intraocular pressure, or IOP. Your eye produces a clear fluid called aqueous humor. This fluid circulates through your eye and drains through tiny channels. When you are young, production and drainage are perfectly balanced. But as you age, those drainage channels can become partially blocked by cellular debris, protein deposits, or inflammation. The fluid builds up. Pressure inside your eye increases. Normal eye pressure is between 10 and 21 millimeters of mercury. When it rises above 21, you are at risk for glaucoma, a condition where the increased pressure damages the optic nerve. Here's what most people don't realize. The same oxidative stress that damages your retinal cells also damages the drainage channels in your eye, reducing fluid outflow and increasing pressure. So retinal damage and elevated eye pressure are not separate problems. They are two symptoms of the same underlying cause: excessive oxidative stress combined with declining natural antioxidant defenses. In 1900, the standard medical approach to retinal degeneration was to tell patients there was nothing that could be done. A bleak prognosis, devoid of hope. For elevated eye pressure, doctors prescribed pilocarpine drops, which constricted the pupil and sometimes lowered pressure, but caused severe side effects, including headaches, blurred vision, and eye pain. Surgery was rare and dangerous. Dr. Kellogg believed there had to be a better way. He had studied the diets of populations with exceptionally low rates of vision loss. He noticed that certain groups in Central Asia, particularly in the Ningxia region of China and in Tibet, consumed large quantities of a small red berry. These populations maintained clear vision well into old age. Cataracts were rare. Glaucoma was almost unknown. A stark contrast to the visual decline prevalent in the West, Dr. Kellogg obtained samples of these berries, which we now call goji berries, and began prescribing them to patients at the Willow Creek Clinic. He documented over 800 cases between 1906 and 1935. The results were so consistent that he called goji berries nature's retinal repair fruit, a testament to their remarkable properties. What makes goji berries unique? They contain the highest natural concentration of zeaxanthin of any food on Earth. Zeaxanthin is a carotenoid, a pigment molecule that your body cannot produce. You must obtain it from food. Once ingested, zeaxanthin travels through your bloodstream, crosses the blood-retinal barrier, and accumulates specifically in the macula, the central part of your retina responsible for sharp, detailed vision. In fact, the macula has such a high concentration of zeaxanthin that it is sometimes called the yellow spot, because zeaxanthin gives it a yellow color. One serving of dried goji berries, about 28 grams or roughly 1 ounce, contains between 2.4 and 3.8 milligrams of zeaxanthin. To put that in perspective, spinach contains about 0.3 milligrams per 100 grams. Corn contains about 0.5 milligrams per 100 grams. Egg yolks, often recommended for eye health, contain about 0.2 milligrams per large egg. Goji berries contain 10 to 15 times more zeaxanthin than any other commonly available food. They also contain beta-carotene, which your body converts to vitamin A, essential for night vision. They contain polysaccharides, complex sugars that have been shown in laboratory studies to protect retinal ganglion cells from damage. They contain taurine, an amino acid that supports retinal health, and they contain high levels of vitamin C and multiple B vitamins, a true powerhouse of nutrients. But here's the critical discovery that Dr. Kellogg made, and that modern research has confirmed: timing matters. Zeaxanthin absorption is significantly enhanced when goji berries are consumed with a small amount of fat, because zeaxanthin is fat-soluble, and when they are consumed in the evening, because retinal repair processes are most active during sleep. Dr. Kellogg's protocol was simple. 1 ounce of dried goji berries, soaked in warm water for 10 minutes to rehydrate them, consumed 1 hour before bed, with a small handful of nuts or a teaspoon of coconut oil, to provide the fat needed for optimal zeaxanthin absorption. Patients followed this protocol daily for 14 days minimum, with most continuing for 30 to 90 days. Now, let's look at what modern science says. In 2011, researchers at the University of California, Davis, published a study in the journal Optometry and Vision Science. They recruited 150 healthy adults aged 65 to 70 and divided them into 3 groups. One group consumed 13.7 grams of dried goji berries daily for 90 days. The second group took a commercial lutein and zeaxanthin supplement. The third group took a placebo. The results were remarkable. The goji berry group showed a significant increase in zeaxanthin concentration in the macula, measured using a technology called macular pigment optical density. The supplement group showed a smaller increase. The placebo group showed no change. More importantly, the goji berry group showed measurable improvements in visual function, including contrast sensitivity and glare recovery, both of which typically decline with age. The researchers concluded that goji berry consumption increased macular pigment density and improved visual performance in older adults. In 2018, Harvard Medical School researchers published findings in the journal Nutrients. They analyzed the chemical composition of goji berries and identified a group of compounds called lithium barbarum polysaccharides, or LBPs. These polysaccharides have powerful antioxidant and anti-inflammatory properties. The Harvard team conducted cell culture studies and found that LBPs protected retinal pigment epithelial cells, the cells that support your photoreceptors, from oxidative damage. They also found that LBPs reduced the production of inflammatory molecules called cytokines, which contribute to retinal degeneration. The Harvard researchers noted that these protective effects were dose-dependent, meaning more goji berries provided more protection up to a certain optimal level. But what about eye pressure? In 2020, researchers at the Mayo Clinic published a study examining the effects of antioxidant-rich foods on intraocular pressure. They found that diets high in carotenoids, particularly zeaxanthin, were associated with lower average eye pressure. The mechanism appears to be related to improved function of the trabecular meshwork, the tissue responsible for draining aqueous humor from the eye. Oxidative stress damages the trabecular meshwork, reducing its ability to drain fluid efficiently. Antioxidants like zeaxanthin protect these cells from damage and may even help repair existing damage. The Mayo Clinic study found that participants who consumed foods high in zeaxanthin had an average eye pressure 2.4 millimeters of mercury lower than those who did not, a clinically significant difference. A reduction of just 1 millimeter of mercury decreases the risk of glaucoma progression by approximately 10%. The National Eye Institute, part of the National Institutes of Health, has been studying the relationship between diet and eye health since the 1990s. Their landmark age-related eye disease study, AREDS, and the follow-up AREDS-2, involved over 8,000 participants and demonstrated conclusively that antioxidants slow the progression of macular degeneration. While the studies focused primarily on supplements, subsequent research has shown that whole foods rich in the same nutrients, particularly zeaxanthin, provide equal or greater benefit. Likely because whole foods contain additional beneficial compounds that work synergistically. In 2021, the NEI published updated dietary guidelines recommending that adults over 60 consume foods high in zeaxanthin and lutein daily to protect against vision loss. Goji berries were specifically mentioned as one of the most concentrated sources. Let me give you a real case that illustrates how this works in practice. In 2015, a 72-year-old retired teacher named Walter Thompson visited an ophthalmologist in Phoenix with complaints of worsening vision. His eye exam revealed early signs of macular degeneration in both eyes. His eye pressure was 23 in the right eye and 24 in the left eye, borderline high. His doctor recommended monitoring the condition and considering medicated eye drops if the pressure continued to rise. Walter had read about Dr. John Harvey Kellogg's around work and decided to try goji berries before starting medication. He consumed 1 ounce of dried goji berries every night before bed, along with a handful of almonds, for 30 days. After 30 days, he returned for a follow-up exam. His eye pressure had dropped to 19 in the right eye and 20 in the left eye. His visual acuity had improved slightly. His ophthalmologist was surprised and asked what he had changed. Walter explained the goji berry protocol. The doctor was skeptical but agreed to monitor him for another 3 months. At the 6-month mark, Walter's eye pressure remained stable at 18 in both eyes. His macular degeneration had not progressed. 2 years later, his vision remained stable with no need for medication or surgery. His ophthalmologist eventually began recommending goji berries to other patients with similar conditions. So, how do you use goji berries correctly? Here is the protocol based on Sure Doctor John Harvey Kellogg's historical records and validated by modern research. Purchase organic dried goji berries from a reputable source. Goji berries are grown primarily in China, and quality varies significantly. Look for berries that are bright red-orange in color, plump, and free from preservatives or added sugar. Store them in an airtight container in a cool, dry place. 1 hour before bed, measure out 1 ounce of dried goji berries. That is approximately 28 grams, or about 2 tablespoons if you do not have a scale. Place them in a small bowl and cover them with warm water. Let them soak for 10 to 15 minutes. This rehydrates the berries and makes them easier to digest. While they are soaking, prepare a small portion of healthy fat. This could be 8 to 10 raw almonds, a teaspoon of coconut oil, a few walnut halves, or a small piece of dark chocolate. The fat is essential because zeaxanthin is fat-soluble and requires fat for optimal absorption. After soaking, drain the water from the berries. You can drink the water if you like, as it contains some of the water-soluble nutrients. Eat the berries slowly, chewing them thoroughly, then consume your source of healthy fat. Do this every night for 14 consecutive days at minimum. Most people see initial improvements in visual clarity and reduced eye strain within the first week. Measurable changes in eye pressure typically occur between day 10 and day 21. For individuals with significant retinal damage or chronic elevated eye pressure, Dr. John Harvey Kellogg recommended continuing the crimsonberry regimen for 90 days, then reassessing with an ophthalmologist. Many of his patients at the Willow Creek Clinic continued eating goji berries indefinitely as part of their regular diet and maintained stable vision well into their 80s and 90s. Now, you should be aware of a few important cautions. First, goji berries can interact with blood-thinning medications like warfarin. If you take any blood thinners, consult your doctor before starting the crimsonberry regimen, as they may enhance the medication's effects. Second, goji berries can interact with diabetes medications. They may lower blood sugar, which is generally beneficial, but if you take insulin or other diabetes drugs, monitor your blood sugar closely and adjust your medication as needed under medical supervision. Third, some people are allergic to goji berries. If you have allergies to other members of the nightshade family, such as tomatoes, potatoes, or peppers, start with a very small amount and watch for any allergic reactions. Fourth, and most importantly, goji berries are not a substitute for professional medical care. If you have glaucoma, macular degeneration, or any serious eye condition, you must continue seeing your ophthalmologist regularly. Goji berries can support your eye health and may reduce your need for medication or delay the need for surgery. but they cannot replace proper medical monitoring. If you experience sudden vision loss, severe eye pain, or see flashes of light, or a sudden increase in floaters, seek immediate medical attention. These can be signs of retinal detachment or other emergencies that require urgent treatment. Now, let me explain the biochemical mechanisms in more detail, because understanding how goji berries work will help you appreciate why this natural approach is so effective. When you eat goji berries, the zeaxanthin they contain is absorbed in your small intestine. From there, it enters your bloodstream bound to lipoproteins, the same molecules that transport cholesterol. The zeaxanthin travels through your bloodstream until it reaches the capillaries in your retina. Here is where it gets interesting. Your retina has a special barrier called the blood-retinal barrier. Similar to the blood-brain barrier, this barrier prevents most substances in your blood from entering the delicate retinal tissue. But zeaxanthin has a molecular structure that allows it to cross this barrier. Once inside the retina, zeaxanthin accumulates in the macula and the fovea, the area responsible for your sharpest vision. It embeds itself in the cell membranes of your photoreceptor cells. This is important because cell membranes are where most oxidative damage occurs. Free radicals attack the fatty acids in cell membranes, causing a chain reaction called lipid peroxidation that damages the cell and eventually kills it. Zeaxanthin acts as a shield. Its molecular structure allows it to absorb high-energy blue light before that light can generate free radicals. It also directly neutralizes free radicals that do form, sacrificing itself to protect your cells. But here's the remarkable part. Your body continuously replenishes zeaxanthin in the retina as long as you keep consuming it. So even though individual zeaxanthin molecules are destroyed while protecting your cells, the overall concentration in your retina remains high and provides continuous protection. Think of it like a fire extinguisher that automatically refills itself. As long as you keep eating goji berries, you maintain a constant supply of this protective molecule in the exact part of your eye that needs it most. The polysaccharides in goji berries work through a different mechanism. Research from institutions including the Beijing Institute of Ophthalmology has shown that Lycium barbarum polysaccharides activate a cellular pathway called NRF2. This is your body's master regulator of antioxidant production. When NRF2 is activated, your cells increase their production of enzymes like superoxide dismutase, catalase, and glutathione peroxidase. These enzymes are your body's internal antioxidant defense system. They neutralize free radicals far more efficiently than dietary antioxidants alone. Though goji berries provide a double benefit, they deliver external antioxidants like zeaxanthin directly to your retina, and they activate your internal antioxidant production systems. This is why whole foods like goji berries are often more effective than isolated supplements. The supplements provide one nutrient. The whole food provides multiple nutrients that work together synergistically. As for the effect on eye pressure, the mechanism involves the trabecular meshwork. This is a spongy tissue located at the angle where your iris meets your cornea. Aqueous humor drains through the trabecular meshwork into a canal called Schlem's Canal, then into the bloodstream. When the trabecular meshwork is healthy, drainage is efficient and eye pressure remains normal, but oxidative stress and inflammation damage the cells of the trabecular meshwork, causing them to become less efficient. They produce more extracellular matrix, a kind of cellular scaffolding which clogs the drainage channels. Zeaxanthin and the polysaccharides in goji berries reduce oxidative stress and inflammation in these cells. This allows them to function more efficiently, improving drainage and lowering pressure. Some research suggests that these compounds may also stimulate the trabecular meshwork cells to produce enzymes that break down the excess extracellular matrix, essentially clearing out the clogs. The result is improved fluid outflow and reduced intraocular pressure. Let me give you a practical 30-day plan. Days 1 through 7. Start with 1 ounce of goji berries every night before bed, with a small amount of healthy fat. During this first week, pay attention to how your eyes feel. Many people notice reduced eye strain, less dryness, and slightly improved night vision within the first 3 to 5 days. These are early signs that the nutrients are reaching your retina. Days 8 through 14. Continue the same protocol. By the end of week 2, you may notice that colors appear slightly more vivid and that your vision is clearer, especially in bright light. This is zeaxanthin accumulating in your macula and improving contrast sensitivity. If you have access to an ophthalmologist or optometrist, consider scheduling an eye pressure check around day 14 to see if there has been a measurable reduction. Days 15 through 21. Continue daily consumption. Some people experience a plateau during week 3, where they don't notice additional improvements. This is normal. Cellular repair takes time. Days 22 through 30. By the end of 30 days, most people report noticeable improvements in overall visual clarity, reduced glare from bright lights, and better vision in low light conditions. If you initially had elevated eye pressure, a follow-up measurement around day 30 typically reveals a reduction of 2 to 4 millimeters of mercury. After 30 days, you have a couple of options. If your vision has improved and you're happy with the results, you can reduce your goji berry consumption to 3 or 4 times per week as a maintenance dose. This is usually sufficient to maintain those benefits. However, if you have a chronic condition, such as macular degeneration or glaucoma, Dr. John Harvey Kellogg's records suggest continuing daily consumption for 90 days, then reassessing with your eye doctor. Many of his patients made goji berries a permanent part of their diet and continued to benefit for years. So, what should you combine with goji berries to maximize their effectiveness? First, stay hydrated. Your eyes need adequate fluid to produce healthy aqueous humor. Aim for at least 8 glasses of water per day. Second, get adequate sleep. Retinal repair processes are most active during deep sleep. Aim for 7 to 8 hours per night. Third, protect your eyes from excessive blue light. This means limiting screen time, especially in the evening, and wearing blue light blocking glasses if you use computers or smartphones frequently. Fourth, avoid smoking. Smoking generates massive amounts of free radicals in your bloodstream, overwhelming the protective effects of any antioxidant. If you smoke, quitting is the single most important thing you can do for your eye health. Fifth, manage your blood sugar if you are diabetic. Chronically elevated blood sugar damages retinal blood vessels and accelerates vision loss. Goji berries can help, but they cannot overcome the damage caused by uncontrolled diabetes. Now, when should you absolutely see a doctor? Immediately. Regardless of whether you're using goji berries, if you experience sudden, painless vision loss in one or both eyes, this could be a retinal detachment, stroke, or other emergency. If you experience severe eye pain, especially if accompanied by nausea or vomiting, this could be acute angle closure glaucoma, a medical emergency. If you see sudden flashes of light or a dramatic increase in floaters, this could indicate a retinal tear. If you see a dark curtain or shadow moving across your field of vision, this is a classic sign of retinal detachment. If you notice distortion where straight lines appear wavy, this could indicate fluid under the retina. All of these symptoms require immediate medical evaluation, usually within hours, to prevent permanent vision loss. You've just learned the exact protocol that Dr. John Harvey Kellogg developed over 30 years at the Willow Creek Clinic, and that Harvard Medical School, the Mayo Clinic, and the National Eye Institute have now validated through modern research. This isn't folk medicine or some unproven remedy. This is a natural approach, backed by over a century of clinical observation and decades of scientific study. Creating this content required reviewing historical medical records from the Willow Creek Clinic, analyzing peer-reviewed studies from institutions including Harvard, UC Davis, and Mayo Clinic, consulting with ophthalmologists to ensure every recommendation is safe and accurate, and translating complex biochemistry into information you can actually use. This is educational content that empowers you to take control of your eye health naturally, while always emphasizing the importance of professional medical care. If you found value in this detailed, science-based information, the Super Thanks feature allows you to support the creation of more videos like this. It tells YouTube that in-depth, well-researched health education matters. It helps us continue producing content that combines historical medical wisdom with cutting-edge science. You're not just a viewer. You're someone who values accurate, actionable health information and wants to see more of it in the world. Have you tried natural methods for eye pressure or retina problems? Share your experience in the comments. Did it work, or did you need medication? Honest answers help everyone here make informed decisions about their eye health.